Medical Coding Fundamentals, Chapter 13, Pathology and Lab Services, Chapter 14, Medicine Services, and Chapter 15, HCPCS. The Pathology and Lab Services section has 18 divisions, and these divisions are based on the type of pathology. We also have organ or disease-oriented panels. This is a predefined cluster of laboratory tests to evaluate a diseased organ, organ system, or a disease. And there are 10 organ panels and 10 disease-oriented panels. Drug testing. There's several different types of testing that can be done to screen for drugs. We have the qualitative screen, which indicates whether or not a particular substance is present in a sample. Quantitative test determines how much of a substance is present in a sample. Your therapeutic drug level is present in significant quantity to have a desired effect, but not in the amount high enough to be dangerous. And your evocative or suppressive testing determines a patient's reactions to a substance by using an agent or increase or a decrease in the patient's level of that substance. There's also several different types of tests that will be performed in the pathology and lab services. We have our urinalysis, which is the examination of urine, typically by chemical or microscopic means. Your chemistry test it's a test that measures chemical substance in a specimen. Molecular pathology describes tests to detect gene-specific abnormalities. Hematology and coagulation, these are tests performed on blood samples. Tests are specific to blood components. We have our complete blood count, or our CBC, our PT, or prothrombin time, which measures the time needed for a clot formation in the blood plasma. Immunology, this is a test to detect specific antigens, toxins, peptides, and antibiotics by a variety of methods. Transfusion medicine, these are services associated with blood transfusions. And microbiology, this is an identification of a specific bacteria, virus, parasite, or fungi. Pathology services, we have our anatomic pathology. This is the examination of tissue to determine the presence or cause of an illness. Cytopathology or cytogenic studies. We have cytopathology. This is tests on cells that are obtained through washings, brushings, lavage, scrapings, swabs. Our cytogenic test, they detect genetic abnormalities or neoplasmic conditions. Our surgical pathology is the examination of tissue samples removed during surgery to determine the presence or cause of a disease. In vivo lab procedures are performed with transinducers. And reproductive medicine, this is lab services associated with reproductive medicine. Chapter 14, Medicine Services. There are over 30 separate code sections within the medicine services and approximately 100 subsections. Okay, of these categories, they include vaccines and administration. We're talking about the administration, which is actually giving the drug directly by injecting or by mouth or any other route that introduces the drug into the body. Psychiatric services describe psychiatric diagnostic interviews. Dialysis, this is hemodialysis procedures combined with evaluation and management services that are related to the renal disease provided on the same day as the hemodialysis services was. Ophthalmology, these are codes describing the evaluation of the visual system that are not included under general ophthalmological examinations. Otorhinolaryngological services include non-surgical ear, nose, and throat services. Cardiology procedures include cardiography, echocardiography, and cardiac catheterization. Pulmonary procedures include ventilation management and pulmonary function studies. Neurological studies include the electroencephalograms, neuromuscular testing, nerve conduction studies, evoked potentials, and functional brain mapping. IV infusions and chemotherapy. IV is for hydration only. In chemotherapy, these codes are describe the administration of the substance. Physical medicine. These are codes to describe therapeutic procedures, wound care, and fitting of orthotic and prosthetic devices. Acupuncture. This is coded within 15-minute increments, and you'll need to know if it was with or without electrical stimulation of the acupuncture needles. And there's also add-on codes used for each additional 15 minutes. Chiropractic manipulative treatments. These are 3 codes, 98940 through 98942, that describe treatments of the spinal region, cervical, thoracic, lumbar, sacral, and pelvic. And 1 code, 98943, is used for treatments of 1 or more extraspinal regions. We also have home health procedures. These are services provided by non-physicians in a person's residence. HCPCS, Chapter 15. This is Healthcare Common Procedural Coding System. It is used for Medicare and Medicaid. It codes for services such as devices and supplies. We have Level 1 HCPCS, which is actually your CPT codes. And Level 2 are the codes for the variety of services, supplies, and equipments that are not included in CPT. So uses of HCPCS codes. They are used when there is no CPT code that describes the item or service provided, when the HCPCS code is more specific than the CPT code, and when instructed by a particular payer. HCPCS, like CPT, has an index and a tabular list, and the index must be used first. You will cross-reference the codes found in the index with the tabular list. And there's also a table of drugs, and this describes medications provided to patients in a physician office or a medical facility. Units of service. This is a particular amount of described services that are included in the HCPCS code descriptor. Identifying services. These are codes that are grouped by types of services or supplies. And codes are alphanumeric. The code categories, see table 15.1. A codes are used for transportation. We have our emergency transportation, which is transportation used to bring a critically ill patient to the hospital. Our non-emergency transportation, which is used to move a patient who is not in immediate critical need of medical care. And we also have different types of ground ambulance services. We have our basic life support, which is the level of care given to a patient with a life illness or injuries until the patient reaches the hospital. And advanced life support, this is a higher level of care that supports the circulation and breathing while the patient is being transported. B codes are used for internal and paternal. These are the provisions of the nutrients to prevent or treat malnutrition. C codes are for outpatient prospective payment system. These are services, drugs, biologicals, radiopharmaceuticals, devices, and supplies that are provided in an outpatient setting. D codes are used for dental procedures. E codes are used for durable medical equipment. This is equipment that is meant to be long-lasting. It can withstand repeated use. It may be used at home, and it's typically not used by someone who does not have a medical condition. G codes are for procedures, professional services, temporary codes, physician voluntary reporting program codes, and last-minute additions. And they identify professional healthcare procedures and services that would otherwise be coded by CPT codes, but for which there is not a CPT code. H codes are for alcohol and drug abuse treatment services. These are used by state Medicaid agencies that are mandated to have separate codes for identifying mental health services that include alcohol and drug abuse treatment services, as well as at-risk prenatal care. J codes are used for drug administration, and they are administered other than oral method, and they include chemotherapy and immunosuppressant drugs. K codes are temporary codes. We're talking about standard and powered wheelchairs, wheelchair accessories, replacement parts would all be included with K codes. L codes are for orthotic and prosthetic procedures. Your orthotic, this is a device that supports an impaired body part. A prosthetic is a device that generally replaces a missing body part. M codes are for other medical services. P and Q codes. P codes are for pathology and lab, and there's 4 sections: chemistry and toxicology test, pathology screening test, microbiology test, and miscellaneous test. Your Q codes are for miscellaneous services, temporary, such as cast and splint supplies. R codes are diagnostic radiology services. They describe transportation and setup of equipment from a facility to a home for the purpose of performing diagnostic tests. S codes are temporary national codes or non-Medicare. You need to report drugs, supplies, or services for which there are no national codes. T codes are national. These are national T codes were established for state Medicaid agencies. Many codes describe nursing and home health related services, substance abuse treatment, and training related procedures. V codes are for vision, hearing, and speech and language pathology services. These services include lenses, contacts, vision aids, ocular prosthetics, speech language pathology, and various hearing services. And just like with CPT codes, we have modifiers. These are 2-character alphanumeric, and they provide additional information but do not change the definition of the code. Okay, this week you'll need to read chapters 13, 14, and 15 and complete checking your understanding for each chapter.